Did you know that glaucoma is often called the silent thief of sight? It's a chilling thought, isn't it? Millions of people are quietly losing their vision, and many won't even realize it until it's too late. Today, we're diving into a question that could be life-changing. Can glaucoma actually cause blindness? And more importantly, what can you do to protect your eyesight from this stealthy, vision-stealing disease? We'll be covering all the crucial details, warning signs, risk factors, and the steps you need to take to safeguard your vision. Believe me, you don't want to miss this, because early awareness could mean the difference between clear sight and irreversible vision loss. Stick around, and you'll walk away with the knowledge to protect your eyes and potentially save your sight. Glaucoma is a stealthy eye condition that can go undetected for years, gradually damaging vision and potentially leading to blindness. It revolves around increased intraocular pressure that harms the optic nerve, the vital link that carries what we see to the brain. This condition isn't singular but a group of diseases, with open-angle glaucoma being the most common type, where fluid buildup creates slow, ongoing pressure, like a clogged drain. In contrast, angle closure glaucoma causes a sudden spike in pressure, leading to rapid vision loss if untreated. Dubbed the silent thief of sight, glaucoma typically presents no symptoms until significant damage has occurred, making regular eye exams crucial. Without them, people may unknowingly lose parts of their vision, as if someone erased sections over time. Its subtle nature often results in irreversible damage, emphasizing the need for early detection. Coming up, we'll discuss how glaucoma can escalate to total blindness and why prompt intervention matters. Topic 1. The connection between glaucoma and blindness. Glaucoma is far more than just an eye condition. It's one of the leading causes of blindness around the world, especially when it goes untreated. At its core, glaucoma gradually damages the optic nerve, which serves as the communication bridge between the eye and the brain. Over time, this damage affects the way we see, starting with peripheral vision loss, which can be so subtle in the beginning that many people don't even notice it. Think of it like the outer edges of a photograph gradually blurring. Without treatment, this vision loss continues to spread inward, eventually compromising central vision and, in severe cases, resulting in total blindness. Once this optic nerve damage sets in, there's no turning back. In fact, a staggering statistic reveals that around half of those with glaucoma aren't even aware they have it, simply because the condition often progresses without obvious symptoms. It's an unsettling thought, millions of people going about their daily lives, possibly unaware that glaucoma is slowly robbing them of their sight. Many individuals might skip routine eye exams, not realizing the potential consequences of leaving glaucoma unchecked. The real danger of glaucoma is in its quiet approach. Vision loss develops so gradually and painlessly that it's easy to overlook. Yet, this stealthy progression is exactly what makes glaucoma so dangerous and why regular screenings are crucial, especially for those over 50 or with a family history of the condition. As glaucoma progresses, its impact on vision becomes more noticeable, often when substantial damage has already occurred. This silent deterioration emphasizes why catching it early can make all the difference. For those who may already be at risk, understanding these subtle early signs can be a game changer, allowing for early intervention and possibly saving their sight. In the next section, we'll dive deeper into these early symptoms, those small, often overlooked clues that can signal glaucoma's presence before it escalates into significant vision loss. Topic 2. Early symptoms and warning signs. Glaucoma is known for its silent progression, but there are a few early warning signs that can alert you before the damage becomes severe. The tricky part? These symptoms can be subtle, especially in the beginning, making it easy to overlook them. For example, one of the earliest indicators is a gradual loss of peripheral vision, or side vision. This type of vision loss can be so slow that people often adjust without even realizing something's wrong. Imagine having to turn your head more than usual to see things on the side. It's one of those small changes that can signal the need for an eye checkup. Other symptoms, like seeing halos around lights, eye pain, and sudden vision loss, are more dramatic, particularly in angle closure glaucoma. This form of glaucoma can come on suddenly, creating symptoms that are harder to ignore. These may include intense eye pain, nausea, blurred vision, or sudden loss of vision, which can feel alarming if it happens out of the blue. While these symptoms may prompt a trip to the doctor, it's the more gradual, less noticeable signs that often go unchecked. That's why it's essential, especially for those over 50 or with a family history of glaucoma, to be vigilant and proactive with regular eye exams. Recognizing these symptoms early can make a significant difference. If you notice any changes in your vision, no matter how minor they may seem, it's worth getting checked. Early intervention is key in glaucoma management, as catching the condition in its early stages can prevent substantial vision loss. The next section will help identify who's at higher risk for glaucoma, so you know if you or someone close to you might need to be extra vigilant. Topic 3. Who is at risk for glaucoma? When it comes to glaucoma, certain groups face a higher risk, and knowing if you're part of that group is a crucial first step in protecting your vision. For instance, age is a major factor. People over 50 have a significantly increased likelihood of developing glaucoma. As we age, changes in eye structure and pressure can make us more susceptible. Family history also plays a substantial role. If close relatives have been diagnosed with glaucoma, your chances are higher, as this condition often runs in families. It's like having a genetic footprint that makes certain people more vulnerable. Additionally, ethnicity can influence glaucoma risk. Studies show that African American and Hispanic communities face a heightened risk of glaucoma, with a tendency for it to appear earlier and progress faster. This makes regular eye exams especially important for these groups. Certain medical conditions, such as diabetes and hypertension, also elevate the risk. People dealing with these health issues should keep an extra eye, pun intended, on their eye health, as these conditions can complicate and worsen the effects of glaucoma. Moreover, prolonged use of corticosteroids, whether for asthma, arthritis, or other conditions, has been linked to an increased risk of developing glaucoma. It's easy to overlook these risk factors if symptoms aren't apparent, but if any of these apply to you, it's worth discussing with your eye doctor. The sooner glaucoma is detected, the better the chance of slowing its progress. In our next segment, we'll dive into how glaucoma is diagnosed, so you'll know exactly what to expect from an eye exam and why it's vital to get checked regularly. Topic 4. Diagnosing glaucoma tests and procedures. Diagnosing glaucoma early can make all the difference in preserving vision, and that's why regular eye exams are so essential, especially as we get older. The first test your eye doctor might perform is called tonometry, which measures eye pressure. It's quick and usually involves a puff of air or a gentle probe to check for elevated intraocular pressure, a primary indicator of glaucoma. High eye pressure doesn't always mean you have glaucoma, but it's a significant risk factor that can help doctors catch potential issues early on. Another critical test is the visual field test, which examines peripheral vision, the first area glaucoma often affects. This test helps doctors spot any loss in side vision that might otherwise go unnoticed. Imagine a machine where you're asked to press a button every time you see a small light flash. It may feel like a game, but it's actually mapping the edges of your vision to detect any blind spots. For a deeper look, doctors might also use optical coherence tomography, OCT, a sophisticated imaging technique that provides a detailed view of the optic nerve. The OCT scan captures a cross-section of the optic nerve, allowing your doctor to see if there's any thinning or damage. Regular eye exams that include these tests are vital for catching glaucoma before it causes significant vision loss. For those over 50 or anyone with a family history, scheduling these tests every 1 to 2 years can be a powerful step in protecting eye health. In the next section, we'll explore the treatment options available for glaucoma, so you'll know exactly how this condition can be managed if caught early. Topic 5. Treatment options for glaucoma. When it comes to managing glaucoma, early treatment is key to slowing the disease's progression and protecting vision. While there's no cure, several treatment options can help control eye pressure and prevent further damage to the optic nerve. The first line of defense often involves medicated eye drops. These drops work by either reducing the amount of fluid the eye produces or by improving its drainage, ultimately helping to lower intraocular pressure. They're a simple daily step that many find effective, though they do require consistency to be beneficial. Think of these drops as a maintenance tool, like oil for a car engine. They help everything function smoothly when used regularly. If eye drops alone aren't enough, laser therapy might be recommended. In a quick, outpatient procedure, the laser opens up drainage pathways in the eye, allowing fluid to exit more easily and lowering eye pressure. It's usually painless and can be quite effective, though some patients may need repeat treatments. For those with advanced or particularly aggressive glaucoma, surgical options may also be considered. Glaucoma surgeries are designed to create new drainage channels, reducing pressure on the optic nerve. While these procedures sound intimidating, they're often necessary to prevent further vision loss in cases where other treatments haven't worked well enough. While these treatments help manage glaucoma, they can't reverse any vision loss that's already occurred. That's why it's so important to catch glaucoma early and begin treatment as soon as possible. Our next section will provide practical lifestyle tips to help reduce the risk of glaucoma and support overall eye health. Simple adjustments that anyone can start right away. Topic 6. Practical tips to protect eye health. Maintaining eye health goes beyond medical treatments. It's also about daily habits and lifestyle choices that support healthy vision and lower the risk of conditions like glaucoma. First and foremost, a balanced diet rich in antioxidants plays a significant role in keeping your eyes healthy. Leafy greens like spinach and kale, along with foods high in omega-3s like salmon and walnuts, are great for eye health. These foods provide the essential nutrients that can help maintain optic nerve health and reduce eye pressure over time. Next time you're grocery shopping, consider adding these eye-friendly foods to your list. Beyond diet, protecting your eyes from UV rays is crucial. Long-term sun exposure can harm your eyes, potentially increasing the risk of glaucoma and other eye diseases. Wearing sunglasses that block 100% of UVA and UVB rays can help reduce this risk. Regular exercise is another excellent way to support eye health. Activities like walking, jogging, or even gardening can help improve blood flow to the eyes, which may aid in maintaining lower eye pressure. Plus, keeping conditions like high blood pressure and diabetes in check through physical activity can prevent complications that could worsen glaucoma. Lastly, routine eye exams are a must, especially as we age. These exams allow doctors to catch early signs of glaucoma and other eye diseases before they lead to significant vision loss. Think of it as a simple preventive measure that can pay off in a big way. Small, consistent changes like these can add up to make a noticeable difference in your overall eye health. Up next, we'll discuss some common myths and misconceptions about glaucoma that might be holding people back from getting the care they need. Topic 7. Myths and misconceptions about glaucoma. Glaucoma is often misunderstood, and some common myths prevent people from taking the condition seriously or from seeking timely treatment. One of the biggest misconceptions is that if you don't have symptoms, you don't have glaucoma. Many people think that if they're not experiencing pain or noticeable vision changes, they're in the clear. However, glaucoma is known as the silent thief of sight, precisely because it can progress without symptoms until significant damage has occurred. It's essential to remember that regular eye exams, not waiting for symptoms, are the best way to catch glaucoma early. Another widespread myth is that only older people need to worry about glaucoma. While age does increase the risk, glaucoma can affect people of all ages. Genetics, certain medical conditions, and lifestyle factors also play a role. Believing it's just a senior's issue can lead younger people to skip eye checkups and miss early detection opportunities. There's also a belief that if you've been diagnosed with glaucoma, there's nothing you can do about it. In reality, early treatment can slow or even halt the progression of the disease, helping many people maintain their vision for years to come. Understanding and dispelling these myths can empower people to take glaucoma seriously and pursue preventive steps. Don't let these misconceptions put your vision at risk. Knowing the truth about glaucoma can make all the difference in preserving sight. So, after learning all this, what steps will you take to protect your eyesight? Remember, glaucoma doesn't always come with obvious symptoms, so regular checkups are one of the best ways to stay ahead of this silent threat. Think about those practical tips we discussed: diet, exercise, and sun protection. Small changes like these can make a big difference when it comes to preserving your vision. And if you're over 50 or have a family history, maybe today is a good day to schedule that eye exam you've been putting off. If this video helped you understand glaucoma better, give it a thumbs up, share it with friends and family who might be at risk, and consider subscribing to stay updated on essential health topics like this. Turn on notifications too, so you never miss a chance to learn something that could make a real difference in your life. And before you go, check out the next video on the screen for more ways to take control of your health and well-being. Thanks for watching, and here's to protecting your vision and living a healthy, fulfilling life.